Awesome. Actually, I'm going to pause the recording really quick. Awesome. Thank you so much, Monica, for being here. My name is Amanda Finley. I started COVID-19 Long Haulers discussion group, and we love doing town halls on all different topics relating to long COVID, and other adjacent topics. So guest, introduce yourself.
Hi, I'm Monica Verduzco-Gutierrez. I am a PM&R physician in San Antonio, Texas. I, just have been taking care of patients with sequelae of COVID since the beginning of the pandemic. Have a long COVID clinic, have an AHRQ grant related to the work in setting up a multidisciplinary clinic. And I am here to answer your questions as much as I can.
Well, thank you so much for being here. I really appreciate you taking time for us. We're just going to dive into it. Number one,
okay.
do I need a positive test to access a long COVID clinic, and why is that?
The answer is, I'm not going to answer for all long COVID clinics, but I'm hoping it's gotten to the point where you don't need a positive test to access long COVID clinics. And I will tell you, as being part of the committee that worked on the definition for long COVID, one of the points that we made was that some people did not have access to testing. Some people did not have a positive test because there was no test for them to be had at that point of the pandemic, or only people who were hospitalized had tests. And, if you were sick, if you had the symptoms, that clinicians should use their clinical acumen to realize, like, this person probably had COVID if it was a surge and they had all the symptoms and people around them were sick with COVID and they lost their smell and taste, things that we know happen with COVID. Then that should be enough to tell you this person had COVID and we should be treating them in the long COVID clinic.
Right. That would be logical.
That would be logical. Yes,
okay.
That's the logical answer.
Right. Yes. A third of the people in my support group were sick in March 2020. Almost none of them had a test. No, we didn't have access to tests, and they're still the sickest.
So. I know, and exactly, that's what we're seeing from the pandemic. That it's like the original variant, the people who got sick at the beginning were the ones who had the highest rates of long COVID, who had the most symptom burden, who continue to have the most symptom burden, and unfortunately didn't always have access to testing.
Yeah. Proof was on us, and it was, how do we do that?
Right.
So this is one that everyone who wrote in asked, what can I do to prepare for my first visit at a long COVID clinic?
I think so. I like patients that come really prepared.
Yeah.
Sometimes it's like, patients will have, okay, I've already had this testing. These are my symptoms. They write things out. And sometimes it's really helpful for patients to write things out, because when you get there, you're like, what am I going to say? Or what did I forget to tell you? Or what else was I going to ask? And so I actually am, appreciate sometimes when people write it out and send it early in my chart, so I get a message for it. Because sometimes I can even like cut and paste that into the note and review it before or right at that time. And, everything's there, that, the history is kind of there and we can kind of review it together. Or maybe I've reviewed it beforehand. And also if there's any medical records of things that have been done, it's nice. So if you're like, oh, I had a lab work and they said it was normal. What lab work?
Yeah.
Like, was it as in-depth lab work that I'm going to give you, or was it just like your blood count and that's it? Or just like your Chem 7 and that was normal, but if nothing else was looked at, kind of thing.
Right.
So,
and even then, like some radiology workups, they'll just put, like, in the impressions, they'll just put, oh, it was normal. But when you read in the body of the report, well, actually there was this that was seemed kind of normalish, but we're not going to, and that could be important.
That could be important, right? And then sometimes in a long COVID clinic, there may be some intake forms. So sometimes you may have to do intake forms, and I like for it to be hopefully not sent just on the day of, because sometimes it takes a lot of cognitive energy to do these forms, especially for people who might have brain fog or who have post-exertional malaise from their cognitive activities. And so it might be nice for them to work on it the day or two before, and not just everything in that time that you're going to be there and do it
Yeah.
at that moment.
Yeah, and I think that gets to another question that we'll get to later.
Oh,
Let's
and
move
then
on.
I guess
Go
I
ahead.
guess my other answer of like what to expect in a long cook. Oh, was it what to prepare or what to
Oh yeah,
expect?
yeah. What to do to prepare for it?
Oh, what to do to prepare
Uh-huh.
for it. Yeah. So I think I think I answered
Yeah.
it then. Yes.
Right.
Okay.
I went to my long COVID clinic, but all they did was refer me to specialists. Is this normal? I love this.
Sometimes, because
Yeah.
it depends on like which kind of specialist you're seeing in a long COVID clinic, because there
Right.
isn't yet a fellowship in like this is the long COVID expert. And then the other thing is long COVID can be anything and everything.
Yeah.
And so there's probably not that one doctor that's a unicorn that's done every kind of fellowship that there is. So
Yeah.
I think when people are unsure, even myself, I'll sometimes, you know, I'm not, I didn't do a fellowship in cardiology and pulmonology. I can do only so much. I can interpret so many
Exactly.
tests. And then if there's something that is out of my realm of understanding, then I'm going to have to refer you to a specialist for something.
Yeah.
So, and kind of the best case is in a center where you can get seen soon or the same day, or
Yeah.
there's discussion, even if maybe you're not seen together at the same time, that there's discussion between the team members.
Yeah.
That's probably the best case, but sometimes it ends up being like, okay, you're having chest pain, I've made sure you're not having a heart attack.
Yeah.
Is it, what do I do with this next piece of information that I have?
Yeah.
Or you had a cardiac MRI and it's like partially abnormal and I don't know what to do with that, then maybe I
Right.
need to send you to a cardiologist to figure out the next steps.
Yeah. Yeah. I think that's really important. Like you said, no one person, unless they're an absolute unicorn, will have all of that knowledge and training.
Right.
So, let's see. How can I find a long COVID clinic near me?
You can like pray and hope and I don't know. Like,
Click your heels 3 times, find it
click your
here.
heels 3 times and
Yeah.
right, exactly. With a unicorn.
Yeah.
So I think, maybe Google, maybe you can actually, if you part, physical medicine and rehabilitation specialist, our national society, the AAPMNR, the American Academy of Physical Medicine and Rehabilitation, actually has a collaborative where there's like 40 plus long COVID clinics, and we meet, we used to meet monthly. We're kind of meeting every other month now to discuss best practices and what we're doing and what we're seeing, and bring up latest research and getting information from different specialists and making publications on the guidelines. So, you might be able to go there and see what are these places that are participating in this collaborative that have long COVID clinics. Word of mouth. There is also support groups. I think support groups offer really good experiences, good and bad, about places that they've gone.
Important.
Yeah.
Yeah. Yeah, I think that's really key. Just use the little search feature in your favorite support group and look for the most recent updates. I mean, if it's something that's 2 years old, that clinic might not even be open anymore. So
right. Yeah, exactly. There are some that have
yeah.
closed, some that, their resources ran out, and
Yeah. Let's see. Well, what will a long COVID clinic do when I'm there? And what can I expect at my first visit?
I know. So that's
Right.
another thing that's going to kind of depend on where you're going, what the clinic has available. But I think I'd hope it would be start with in-depth history and physical examination. So if it's someone's first time visiting a long COVID clinic, I want to hear about, when you had COVID, what were your symptoms like when you had COVID? At this point in the pandemic, sometimes it's how many times have you had COVID?
Yeah.
How bad were they? What was the timeline of them? I want to know if people were vaccinated or not. We know sometimes not being vaccinated lends itself to having more long COVID, but also it doesn't matter, vaccines. People who are vaccinated, they also get long COVID. But I like to, just gives me another little historical perspective
Yeah.
on the patient. I want to hear about, and sometimes the symptom list, the symptom burden is a lot. So
Yeah.
sometimes I will, if they didn't come with it all listed, you know, I do have a symptom kind of checklist, but then I will say, like, what are the three most burdensome things? If there are three things that bother you the most that we can talk about or start with, you know, the workup, the education about what you can do, what are those things that we can get to today? And then maybe leave for a next visit some of the other types of things.
Yeah.
And then hopefully someone would get a physical exam based on the symptoms that they had. You know, we see so many high percentage of patients that have autonomic dysfunction, dysautonomia, or POTS. So I would hope that other than just, a lot of times regular vitals are done. You're not going to catch POTS with just checking someone's blood pressure sitting, right? Even sometimes just doing regular orthostatics, you're not going to. Kind of the gold standard test to start with is doing a 10-minute stand test or an axoline test. So if that can be done during the clinic visit, that is great, because that'll tell us a lot, at least about, you know, are they meeting the criteria with the raised heart rate, and what are the other symptoms that they're having. Listening to heart, listening to lungs. I am a specialist in neurologic rehab, so I do a good neuromuscular exam, want to see, you know, what is the strength? Is the strength, you know, give way? What is their sensation? You know, do they have a neuropathy? Do they have a small fiber neuropathy? What is, you know, those kinds of things are really important. If someone comes in with shortness of breath, what do their heart and lungs sound like? Do they have swelling somewhere? Do they have some kind of signs of other kind of heart failure? So you do it also based on, you know, the symptoms that they come in with, and hopefully do a more expanded physical exam that way. A lot of times I try to spend some of the first visit on just saying, like, just providing education as well about what we know, validation. Like, a lot of patients are not even getting the diagnosis of long COVID or whatever type of phenotype that they have. And to be like, guess what? You also are meeting the criteria for POTS, and this is what we do for that. Or you are actually, you know, there's some studies that show a lot of patients have ME/CFS type phenotype of their long COVID. And guess what? You need to pace yourself, or you need to cut down on what you're doing so you can feel better. And some people have never heard that before. And just educating around what we know, what we don't know. You know, a big part of what I do is symptom management. So, you know, we don't have that. We need that magic pill cure, but we don't have that yet. So until then, I'm going to try to control everything that can be controlled as much as possible. And maybe that was part of me being a doctor who took care of patients with brain injuries and strokes. I couldn't take away their brain injury or their stroke, but I can manage part of the symptoms that they had with the diagnosis, whether it be like cognitive, mood, spasticity, physical, fatigue. You know, we have medications to try to modify all of these things. If someone's not sleeping, how do we get them to sleep? If patients have POTS, there are both non-pharmacological and pharmacological medications to treat POTS. If someone has mast cell activation, there's a really kind of easy treatment for mast cell activation. You know, if patients have you know, you work them up and they have asthma, we have treatments for asthma. If they had a few migraines before, now they have severe episodic, you know, severe, like more chronic migraines, we have treatments for migraines. It's not just like let it go or this is only depression. Like, we can at least hit all these things, even though I don't have the pill to be like, let me fix your neurovascular dysfunction, but can I at least control everything else so you're not suffering?
I think, and that's really important to remember. I went through something similar about a decade ago when I lost my hair, and I went into these clinics expecting an answer, and that's not how this works. We're going to work it up, and we're going to treat the symptoms until we figure out what's going on. But I think that's a big part of what I wanted to do here today, is to set those expectations of, okay, this is what's going to happen, and that we have a plan for some of this.
Right. And a lot of it is, what workup have you had done and what have you not had done yet?
Exactly.
And so is just a chest x-ray enough? No. Do you need like a high resolution CT scan?
Yeah.
Do you have some symptoms that are consistent with possible rheumatologic or autoimmune? Then why aren't, but you haven't had anything checked that was autoimmune yet, do you check it, right?
Yeah. This is an interesting question. How do you tell what type of long COVID clinic it is and how their specialists communicate to one another? I'm going between two different clinics, and I have one where the team is sitting together every so often and they consult regularly. And I feel like this is so much better than the silos.
It is so much better than the
It
silos,
is,
and a lot of
yeah.
places don't have that set up because it takes
Yeah.
effort, it takes money, it takes
Yeah.
coordination, it takes like a lot of efforts with institutes to do that.
Yeah.
It takes, I mean, we're still even making ours to work as much like that as possible. And even with a grant, it can be hard, So
Right.
when you think about like people's time and the places they need to be and getting everyone under one roof and even,
Yeah.
making meeting to discuss patients. And I guess the answer, like, how do you know what kind of long COVID clinic it is? Yes, you don't really know unless it's,
Yeah.
on their website and it says like, we're all working together under one roof, or this is multidisciplinary and you're going to be seen by multiple specialists during one visit. I think that's great. It doesn't always happen,
Yeah.
but if at least like, are you hoping that this is a clinic that will, consult with other specialists that are needed? And the other thing is, sometimes, at least in our system, we all have Epic and we can look at what was done at the hospital and what was done through other specialists in our own system. So at least I can see what every other doctor is doing and what they ordered and what they discussed in their note and what medications they prescribed. So it's at least nice to have the same electronic medical record within the specialist that I'm sending them
Right.
to.
Yeah.
And then the patient has access and the patient can see it and the patient can send us questions that they have as well. So yeah, it's hard to know exactly what kind you're getting into unless it's documented on their
Right.
website or something. And then you can always ask for them to communicate with your other physicians if you want to have them
Yeah.
to do that as well. The thing with like the way billing and coding works now for physicians is like they can bill for time that they spent even not in the visit. So if
Yeah.
you're on that day, so it's like, okay, can you call my doctor today? And they can add that time to the visit and get like maybe charge higher for the visit to the insurance company sort of thing. So
Yeah. And I think you had said you can ask questions. Please do ask questions. I think a lot of patients can be intimidated about should I ask my doctor that? Am I gonna sound stupid or am I gonna waste their time? No, ask the question.
yeah,
Yeah.
asking questions for sure.
Yeah. Uh, do patients work with a long COVID specialist over time, or do you just offer one session and then refer out?
So I have patients that I've been seeing for like 4 years now that the
All
clinic's
right.
been open. And
Yeah.
so especially like we talked about, the ones from earlier in the pandemic continue to have some chronic issues. And sometimes the visits get shorter. I don't know. I guess long COVID
Mhm.
clinics are different, but some of the
Yeah.
visits get shorter. But sometimes they come in and they say, like, what else is there? What haven't I tried? Even they
Yeah.
just sometimes want education or they want to know that they're continuing to do the right things and the right treatments. And sometimes they even have questions like, what do I do if I get COVID again? Or what do
Yeah.
I when should I get a new vaccine? Kind of thing. And so I'm just there to provide more education, to sometimes refill medication. Sometimes there are things maybe they haven't tried, and it might be like, oh, I've seen a lot of patients now do well on low dose naltrexone, and you never
Uh-huh.
tried it. And then the other thing we offer patients is sometimes getting into clinical trials. So I may not have
Yeah.
seen them in a while, and it's like, oh, well, now we have this, clinical trial that we're offering, and so let's refer you to that. And that's
Yeah.
why it's nice to kind of see them again. And then the other thing about long COVID is that in some people it's kind of relapsing and remitting, so sometimes they're good and sometimes they're bad, and so sometimes you catch them when they're bad and sometimes you catch them when they're good, and kind of
Right.
nice to see both. Yeah.
Yeah. I think this is a good question to dive into. What lab test do you perform to diagnose long COVID?
answer to
Right.
that is no lab test. I don't know.
Right.
Is that right now long COVID is a clinical diagnosis. That doesn't mean that I'm not going to do any lab tests, but
Yeah.
and there's lab tests that depending on what the patient has and how they're doing, that lab tests things need to be worked up no matter what they have. But I don't have to wait for an abnormal lab test to come back to say you have long COVID.
Yeah.
Just based on what we know, presumed or positive SARS-CoV-2 infection. And then they have new symptoms or conditions that have occurred that are ongoing for 3 months. Then that's enough for me to say,
Right.
like, guess what? This is a long COVID diagnosis. You have long COVID. This is what we're going to do about it, whether it be more workup, more trial different kind of symptom management or treatments, that type of thing.
Yeah. I think that sort of gets to we need biomarkers, but at the same time, I sort of die a little inside when we need a biomarker. Well, and then if people don't have that specific biomarker, they get excluded from care. So
Right.
it is still long COVID.
It's still long COVID, and yeah, we need a biomarker, but there's that research comes out at the time where it's like, oh, these people with methylated DNA that methylated
Right.
this way, they were found to have long COVID. Like, oh, great. That's a great research thing, but in a clinical setting, I cannot methylate, like look at everyone's whole genome and figure out if they methylated a certain way or not,
Yeah, long COVID is far more complex. And then getting to that, what symptoms can a long COVID clinic help with at this point, and what treatments are offered? And we kind of touched on that a little bit, but anything you want to add to that? Yeah, anything you
So I
want to add?
think one important part I think about like long COVID is just saying if someone has post-exertional malaise, post-exertional symptom exacerbation, because I think one of the things is just educating about the pacing themselves and energy conservation techniques. And we know for some patients, exercise makes their muscles necrose. Like it's not good for them. And so it's almost like figuring out kind of like who are going to be those patients that need to learn how to pace themselves in certain ways, and ones who can start doing a little bit of activity and increase their activity load slowly. So, I mean, I think that's one thing that's super important just to like figure out about long COVID is looking at post-exertional malaise, post-exertional symptom exacerbation, and teaching about, using their energy envelope, using like pacing themselves is super important. I think that we have to screen for things that could be dangerous. Like if someone's like, I have chest pain every time I try to walk and exercise and it goes up my left arm, then like, okay, you're not, oh yeah, let's work that up. If someone's like, I have problems breathing, then you need to get pulmonary function tests. If that person has asthma, what can we put them on for asthma? If someone's like, my blood pressure goes up all the time and they have endothelial dysfunction or hyperadrenergic POTS or hypertension that developed, we can't be like, oh, it's just long COVID. You have to treat their blood pressure, like, yeah, treat it. The same thing, like I said, with POTS. Some people are so stuck like, oh, you need a tilt table test. Well, what if they had a stand test and then they met the criteria for it, then you can start treating the patient.
Or they do a tilt table test and it throws them into a crash.
And it throws them into, oh my gosh, yes. Oh my gosh, I've had some crash so bad, even doing pulmonary function tests, actually.
Yeah.
I mean, and that's even like, the funny thing is like breathing is so important. And it is, right? And some patients with long COVID, they have dysfunctional breathing patterns. They have and sometimes we work on breathing, like teaching them breath work and taking, getting their diaphragm strong again and having normal breathing patterns because their breathing patterns are all dysfunctional.
There are good opera singers out there doing that work too. Who are working with people post-COVID to work on their breathing and their diaphragm, the diaphragm movement. So,
Yeah, and like I said, if someone has sleep disturbances, we
mhm.
have meds for that. We have, you know, get them a sleep study. If someone has migraines, we have treatments for that. If someone has cognitive deficits, then we need to work that up. You know, do
Yeah.
they need more in-depth testing? Do they need speech therapy? Do they need cognitive enhancement medications? You know, there are things to do for those conditions. It's not just,
Yeah.
okay, you have it, you can live with it. Like, I feel like everything has something we can try to manage. And then there's things like low dose naltrexone, which in general we're seeing has been helpful
Mhm.
with some patients with long COVID. Maybe it's just helping kind of like calm the immune system, be a little like anti-inflammatory, help with some of the, you know, some symptoms. And I'm always, you know, willing to try these things. And again,
Which is great.
the importance of working the patient up and finding things that can be corrected as much as possible. So it's like, oh, this person has low iron, low ferritin. Why don't we put them on iron or get them an iron infusion?
Yeah.
That's probably going to give them, I mean, it's not going to reverse it or cure them, but it's going to give them a little bit of energy. And guess
Right.
what? You need iron to also help with your
Very,
neurotransmitters and
yeah.
everything. Like, yeah,
Iron is important stuff.
iron's important stuff. Let's
Yeah.
make sure patients have it. Yeah.
How much time is allotted to an initial appointment? This person is trying to figure out how many questions they can bring in.
Yeah.
They can
I think it depends. I would probably say like 45 minutes, an hour might be initial appointment. Um, and so, but it depends on the kind of the clinic you go to and
Yeah.
what they have set up. Or if you're seeing multiple people at once, maybe you have shorter time with multiple people at a visit.
Hmm.
And that's why it's good to like bring your questions, maybe
Yeah.
bring things written, send it through my chart before type of
Right.
thing. Yeah.
Yeah. Which is a great tool.
It is.
How do you decide what's important to share and what's not when you have so much going on?
I know
Right.
it's hard. Yeah. I think that's where I like the prioritization questions. So
Yeah.
you have to kind of also prioritize it for yourself
Yeah.
and say, like, okay, what's really bringing me down right now? Because what it might be like, oh, my fatigue is so debilitating, but I can't sleep at night. And, um, you know, and I'm getting rashes all the time or something, you know, and those might
Yeah.
be the major things, but there are probably 5, 6 other things that are there, but maybe aren't the worst things at that time.
Yeah.
And maybe things, once these are addressed, do we move these down the list and bring these up at another visit? Yeah.
Let's see. If I had general labs or imaging done back in 2020, 2021 after my first infection that yielded no significant findings, should I still try to find a way to have those forwarded to my clinic prior to my initial appointment, or should I wait until I'm asked?
That's interesting because if they
Uh,
were done in 2021 and they were all normal, then like, okay, that's not going to help me too much now that it's been, you know, 3 or 4 years later. Um, yeah, I guess
it
they
can be
could be
tricky.
forwarded. I don't know a good answer.
Yeah,
Like they could be, or if they were normal, then that's the thing about long COVID. Like a
right.
lot of the labs are normal. And
Yeah.
so it,
Well,
yeah, I'd be more interested if there was abnormal stuff.
yeah, I think the one that gets me during that time period, everybody was getting brain MRI, and all the brain MRIs came back with, oh, it's just what was it? Diffuse small white matter changes that are
Yes,
normal,
diffuse.
consistent with normal signs of aging. And
Hmm.
that was like,
Right.
but she's 30.
Yes, the
Yeah.
normal
So
30-year-old.
yeah, the
Right.
normal 30-year-old. So we
Right.
saw that a
And
lot. So it's helpful
yeah,
to
and then
have like that.
yeah, and those are usually all done like normal 3T MRIs.
Yep.
And I would love that we'd get some new technology out to be like, oh,
Right.
can we all get like 7 Tesla MRIs? I bet we really see some good stuff
Right.
there. Yeah.
Or I guess if you're going to do something for comparison, like if you have, I have a brain MRI scan from pre-COVID. I haven't had one after COVID, but I would be
Mhm.
interested to see, okay, what did it look like a few years before? So I can
Mhm.
come back and tell you this is not normal signs of aging.
It's not normal size. Right. Yeah.
Yeah. Let's see. I have trouble following through on getting on getting ROIs to move data from one healthcare network to another because of brain fog and the number of steps this can take. Can a long COVID clinic help me with that via a care navigator or case manager?
That's like best case scenario. That costs money.
Yeah.
Yes.
I gotta tell you, and
Course.
that's like pie in the sky dream, is to have that accessible to everyone, and something that's been on a back burner idea of mine, but
Mhm.
yeah,
My
it's gonna
other
take
thought is sometimes like your insurance company may not have a care navigator because your
yeah,
insurance company doesn't want you to use all their resources and get like 20 tests over and over again. So
yeah.
sometimes you can go to your insurance company and be like, do you have care navigators or
Mhm.
nurse case managers that will help me kind of get my information to a certain place so I'm not doing a chest x-ray 20 times and
Right.
labs 20 every single place that I go to, and help coordinate my care a little bit more. But there's some that have care coordinators that cost. That's something that doesn't get reimbursed. So it's usually
Yeah.
something that comes from a grant or something,
Uh,
which
yeah.
doesn't it, that kind of wonderful money doesn't just fall from the sky. If someone who's listening, if you're really wealthy, if you want to help,
You're my
fund some,
favorite.
you're my favorite. If you want to help fund our clinic's care navigation, please give me a call. We're taking donations.
Yes, absolutely. Well, and
Yes.
I went through behavioral health at the hospital system where my long COVID clinic is. And
Mhm.
behavioral health has helped me navigate a lot of these things. Like they have picked me up and taken me to appointments. So
That's awesome.
yeah, they've been great. I'm out of their care area now. I think I need to go check since I just moved into this shiny new apartment. But
Mhm.
yeah, check with behavioral health if your system has that as well.
Oh, behavioral health so hard to get in some systems. Like there's such as
Yeah.
like a stress on the system for behavioral health.
Yeah, especially right now. I mean, it was one thing before the pandemic, after the pandemic, or no, I don't want to, during the pandemic. Oh, God.
In the pandemic.
In
Yes.
the pandemics plural.
Right.
Oh gosh. How do you make sure you're in the best shape possible, i.e., not in a crash, prior to your initial appointment at a long COVID clinic, so as to be able to advocate for yourself effectively? Are there tools or techniques or meds that can help me get a good night's sleep or rest the day before?
Oh, that's a great
Big
question
question.
because
Yeah.
it's a big question. Yeah. I think you'd have to know yourself and you're like, okay, well, I'm gonna, that whole thought of like your energy envelope or your spoons and be like, well, I'm gonna have to use all
Yeah.
my spoons for this visit. So that
Right.
means, the days before, I'm trying to optimize my sleep. I'm trying to do as little as possible because I know when I go to long COVID clinic, I want to give them my attention, my energy, my um, listening type of thing. And the other thing I have to say is like, if you feel that it's really hard to do something like that, see if there's options
Yeah.
for, you know, tele telemed appointments
Yes. I like
or maybe follow
telemed.
up in telemed. Yeah.
Yeah. Yeah. My PCP is really great about telemed, email, phone calls. So
Mhm.
I really
Nice.
like that guy. If you're in Kansas City and you need one, call me.
Yeah.
Um, what else can a long COVID clinic help with?
Um,
That it kind of depends on where you are,
Okay.
but
Yeah, it depends on where you are, what services they offer. Because some are multidisciplinary, some are have, support groups, some have educational sessions, some have uh, m- they have special events for their, people that come through. And so it just really depends on the center and what they have.
yeah. Yeah, mine has been really they actually called me 6 months before they opened to ask, what do we need to know? And I was like, that's it right there.
That's right.
So
Yeah, and
yeah,
and
they've
some of
been
them
great.
have access to research trials. That's like
Yeah. Yeah, I think that's really important and just communicate. So
right.
I think we made it through all the questions. So off
Yay.
go to the bathroom and get something to eat and then off to your next
Yes.
thing.
Okay. Thanks.
Thank you so much, Monica. It's been
You're
great seeing
welcome.
you.
Good to
See
see
you
you.
later.
Mhm.
Bye.
Bye.